Hello and welcome. I'm Mark from the X community, found on BecomeAnEX.org. I am the community manager there, and we welcome you to Lung Cancer Screening Saves Lives. Today our guest is Dr. Jeffery Yang from Mass General. He is a thoracic surgeon. He will be joining us to talk about LDCT scans. Joining him as well is Deepti. They are from the Lung Cancer Screening Initiative. We welcome you. Thank you for joining today. Could you please introduce yourself, tell us a little bit more about you, and then we'll move forward.
Great. Well, thanks so much for having us today. I am a thoracic surgeon at Mass General. I take care of patients who have lung cancer, and I am really focused on trying to get people screened for lung cancer because lung cancer screening saves lives. And I have the opportunity to work with Deepti, who is a director at the American Lung Cancer Screening Initiative.
I forgot to mention, Dr. Yang is the founder of the Lung Cancer Screening Initiative, and you can find them at alcs.org.
Yeah, alcsi.org.
Thank you. Thank you so much. So today we're just wanting to get you here, the X community. We have lots of people who are huge on recommending lung cancer screening. A couple of years ago, there wasn't such a big thing that people knew about, but the community has been sharing that with others. So we have Deepti here, who will be asking Dr. Yang some questions just to familiarize people with LDCT scans, and hopefully we can spread the word more through this live event and also through our community, and pass on all the wealth of knowledge that you have. So, Deepti?
Yeah, really excited to be here and be part of this discussion. This is really great. So our first question for you, Dr. Yang, is what does lung cancer screening really involve? So what happens before, like what's the preparation, what does the day of look like, and then what does it look like after you get the screen?
Great. That's a great question. So with regards to lung cancer screening, you first have to be eligible, and a lot of people are eligible. About 15 million Americans are eligible every year. These are folks, if you're over 50 to 80, and if you have a 20-pack year smoking history, which is just the way of figuring out how much you've smoked. There are easy calculators for that, and we can talk about that a little bit later. Or currently smoke and have stopped smoking within the past 15 years, you're eligible to get screened for lung cancer. And I think it's important to know that lung cancer screening saves lives, and that's why we all care about it so much. Every major medical association recommends screening for lung cancer, and it is painless, so it's very comfortable to get a scan. It only takes about 5 minutes. You keep all your clothes on. There's no preparation for it, and it's covered by healthcare insurance. It's covered by private insurance. It's covered by Medicare. And so if you have private insurance or Medicare, it's free. You don't have to worry about the cost. And what it is you just lie on a table, and the table passes through a scanner, which is an X-ray machine that takes many pictures, detailed pictures of X-rays, and at a very low dose of radiation, so it's safe. And these images are then seen by a doctor who knows how to interpret these images and figure out whether or not you have something that might be concerning for lung cancer, or whether you don't have lung cancer, which would be great, but that you'd still want to get that scan every year to make sure that nothing new shows up. And that's one of the reasons why low-dose CT scans work so well at saving lives, is because it helps to identify lung cancers at its earliest stage. And the earlier you can find lung cancer, the better. The more likely you can get treatment that leads to cure or can extend your life. So I think in short, the things to remember for lung cancer screening is that it's safe and it's easy and it's free if you have healthcare insurance.
Thank you so much for that breakdown, Dr. That was great. Just following up on that, once someone figures out that they're eligible for screening, what are the steps that they would need to take in order to be able to even get the screen?
Yes, so I think that that's a great question. Right now, what you have to do is there are different pathways to getting screened. One way is to talk to your doctor, your primary care doctor, or where you get primary care treatment or evaluation. So a nurse practitioner or a physician assistant can also talk to you about lung cancer screening and order that test for you. They'll have a conversation with you. It's what we call shared decision making. So they'll tell you about the risks and the benefits of lung cancer screening, and then if you're okay with it, they'll put in that order for you. And recently, there's been a change in some of the guidelines, and a trained nurse, so somebody who is not a doctor but who knows how to talk about these things, can also help you get that scan. And that's one pathway. The other pathway is there are some lung cancer screening centers where they just have a phone number that you can call, and then you just tell them you want to see if you're eligible. They'll help you figure everything out. They'll get you plugged into their center directly. And so that directly bypasses having to go see your primary care doctor. Not that many centers are like that, though. And so really the main way of getting a scan ordered is through primary care. And then after that, you would schedule an appointment and you go to the CT scanner area. It's usually in a hospital or in a medical center, and then you get your scan. And then in a few weeks, you usually get the results, and then your doctor will talk to you about the results.
Thank you. You kind of jumped our next question as well, but how long does it take to get the results usually after you get the scan?
Yeah, so it takes usually seven days, but it depends on the center. Some centers are very busy these days and short-staffed because of COVID and other reasons, and so it's roughly around 7 to 10 days that you'll get the results.
And then just to follow up on something that you mentioned earlier, you said that the scan is covered for people who have Medicare and Medicaid. Are there any additional resources that someone who doesn't have any insurance would be able to use to get access to screening?
Yeah, so that is something that I'm very happy that anybody who has Medicare, they will be covered for low dose CT scan. So it's completely free if you have Medicare. And a lot of Medicaid plans will also cover for low dose CT screening, although it does depend state by state. In terms of folks who don't have healthcare insurance for low dose CTs, I think that is going to depend on each hospital and medical center. Unfortunately, there's no national resource for that. That is something that us as a nonprofit, the American Lung Cancer Screening Initiative, that's something that we are trying to work on for the next steps, is to help people who don't have healthcare insurance get their CT scans covered. And then in terms of whether or not there are special facilities that do low-dose CT scans, I think it just depends. Some hospitals do it, some radiology centers do it. We're actually trying to help Roswell Park. There is a team up there led by Whitney Mendel, who they're trying to figure out in New York State what the available facilities are. And so we're going to team up with them to call 700 different facilities to figure out what exactly their resources are to get people screened for low-dose CT.
I think you're muted, Mark.
I guess I was on mute. I apologize about that. But I was saying that was excellent. I definitely would like access to that resource. Our community is national. People will want to know how, where to get this LDCT scan. We have many community members who have done it. And so just having another resource to spread the word and make people feel comfortable so they can begin that dialogue with their medical professional, that would be amazing. So So happy.
And then also in terms of resources, we have our lung cancer eligibility assessment, which any of your members can take. And if they take this assessment, we ask for their contact information at the end if they're comfortable. And then someone in our team at LC will be able to connect them to their local screening center no matter where they are in the country. So that's another really helpful resource if anyone is looking to get screened, figuring out if they're eligible, or is looking for next steps in how to get screened.
Yeah, thanks for bringing that up, Deepti. It's on our website under the Get Screened tab, and we are actively trying to help people who fill out that survey and questionnaire to get them screened. So basically, we're trying to provide one-on-one guidance for that, because we do know that getting screened for lung cancer can be challenging. It'd be hard to figure out how do you even get the order, what places do you go, and all these questions that are coming up right now can be complex. And so that's why we're excited to launch that initiative, which just started this past year.
Excellent.
Now jumping back a little bit to the question of what happens after taking the scan, do you have any advice on how patients can manage anxiety when waiting for results and how to handle that stress?
That's a great question. So I think the first thing to understand is that scan anxiety, or it's sometimes called scan anxiety, the anxiety that comes from a scan, it does exist, and recognizing it is the first step to helping to figure out how to manage it. And I think it's important to get support from your family and your friends, and also to seek advice from your doctor, specific advice that is helpful for you. There are different websites out there. WebMD, for example, they have some good general tips, and some of their tips include learn how you react to these kind of stressful situations, because if you can identify what kind of reactions you have, you can then spot out when you are anxious or when you're stressed, and then take the steps necessary to reduce that stress and anxiety. Some typical tips that people have include setting time limits on these worries. So try to block out a little bit of time once or twice a day to focus on these anxieties. And then for the rest of your time, hopefully, if you concentrate your anxiety during those times, then the rest of the time, try to let yourself enjoy the day and go about your day, to try to stay present in the moment, use different relaxation techniques, meditation, and try to potentially keep yourself busy, and maybe take a trip before or after, or something that can get your mind off of the anxiety of the scan. And then also work with your doctor, so they can do things like maybe get your scan done in the morning, so during that day you don't have to be stressed for 8 hours and when you get your scan at 4 p.m., for example, and different tips. So I think in general, though, the most important thing to recognize is that this kind of anxiety does exist. But the good news with all of this is that the reason why I'm very excited about low-dose CT screening is that when you get your results, there is a concrete plan of action that your doctor will help you take that will help you go through this entire process. So what I mean by that is, let's say you do find something that shows you might have lung cancer. There are really good next steps, really good treatments for lung cancer that are available now in 2022 that weren't even available 5 years ago. And so this is, lung cancer is a very serious diagnosis, and it can be a scary situation, but we're so thankful in 2022 there are really good treatments, really good plans now to help patients live much longer, and to help them through this journey.
So we did have a question from the community about this. So the first scan, correct me, is kind of your baseline to kind of get an understanding of what your lungs look like today, and then year to year, it's continuing to get those screens so that you know if there's changes. Correct?
That's correct. Yes. Yeah, you want to make sure to get that first scan, but then every year, you want to keep getting that scan, definitely. And in fact, the big randomized trial in the United States that showed that lung cancer screening saves lives, it wasn't just one scan, it was 3 scans. And a lot of the lung cancers, about half the lung cancers, were picked up on the second or the third scan, not the first scan.
Good to know. I like how you spoke about anxiety. Certainly, we want people to take that first step and get the scan. Certainly, there's some anxiety about getting the results after you have the scan, but we don't want it to be a barrier. So, taking care of your mental health to get you to the point to get that support to focus on getting that scan is really important. You need to have the information to move forward. So it's really important to go get that scan so that you're aware of your health and your healthcare professional can help you move forward. And hopefully there's nothing wrong, but if there is, you have that information to take action on it, as Dr. Yang says. Deepti, did you have any other questions? I can't remember what number question we are on at the moment.
Yeah, I have just a couple more. Kind of moving into the discussion of what happens after the scan. Dr. Yang, would you mind taking us through what are the different possible results and what those different results mean after a scan?
Yes. So after you get the results, the radiologist and other doctors who are trained on how to read these scans will probably classify some of the findings. So in the criteria for that, it's called lung RADS. And but in general, what happens is if you don't find anything, that's great. But if you qualify for lung cancer screening, you still want to get a scan every year. Then sometimes you will find some things, just some small nodules. And actually, I have a little pocket nodule notebook. But basically, you might find something that looks like these nodules on the scan, and some of them might be more concerning for cancer, and others might not. So, and it's based on size and also the shape and the contour of the nodules that you see on the images. But if you have a small nodule that people don't really know what to think about because it might not, it's not clearly obvious it's cancer, but they're not quite sure. Usually what happens is you get another scan, but not in a year, sometimes shorter, maybe 3 months, 6 months, and sometimes 1 month, in 1 year if they're really not concerned about it. That's one possibility. The other possibility is they do find something that looks concerning. It's bigger, it has different shapes and different features, like what you call spiculated, kind of little spikes going out. In that case, then usually the next steps are to talk about biopsy. So this is where you get a little bit of tissue to figure out what that nodule is, or sometimes you might even go straight to surgery or treatment. It just depends on the situation. But largely speaking, I would say you either can watch it if it's not too concerning, and if it's more concerning, you want to either biopsy it or even think about going straight to some types of treatment.
Thank you for that insight, Dr. Yang. Just one last question from me, circling back to the beginning of the discussion, before even getting screened. Could you kind of take us through and break down the criteria for who's eligible for lung cancer screening, and maybe break down that PAC-care calculation as well?
Yes, so that's great. Great question. So basically, if you're the the really nice thing about 2022 is that the guidelines have changed, and they just changed last year, and they're more expansive now. So more people than ever are eligible to get screened for lung cancer. And so if you are between the ages of 50 and 80, if you have a 20 pack year smoking history, and you currently smoke or stop smoking in the past 15 years, you are eligible to get screened. And so a pack year, it's used to describe how many cigarettes you've smoked in your lifetime. And your doctor or your healthcare provider, your nurse practitioner or physician assistant that you see in primary care, they'll usually help you figure out the pack year history. But if you want to figure it out for yourself, there are good calculators online. And just in general, 1 pack year means that you smoked a pack of cigarettes a day for 1 year. So if you have a 20 pack year smoking history, it means that you've smoked 1 pack of cigarettes a day. So that's 20 cigarettes a day for 20 years. And that is the equivalent of 20 pack years. And so if you smoked more than that, and you're between 50 and 80 years old, and you are currently smoking, or you stopped smoking in the past 15 years, then you'd be eligible to get screened for lung cancer.
Could you maybe explain what a pack year is, just to ensure that other people know what that is?
Yes. Yeah. And the lung cancer screening criteria is complex. So there are different components. So absolutely. So in terms of a pack year, this is a way to figure out how many cigarettes you've smoked in your life. And so 1 pack year means that you have smoked 1 pack of cigarettes a day for 1 year. And as you know, they're different. Not everybody smokes 1 pack a day. Some people might smoke 10 cigarettes a day or half a pack a day. So if you smoked 10 cigarettes a day for an entire year, or half a pack of cigarettes a day for the entire year, then that counts as having a half pack year smoking history. So 0.5 pack years. And but because this can be quite complicated, I would encourage everybody, when you're talking to your primary care doctor, to have them help you figure it out. And also there are online tools that can help you figure out how many pack years you're smoking, because there's there are different variations on this, and different considerations that can get a little complicated.
Excellent. I did have another question. So we have a mix of people who are cigarette users, people who vape, people who use chewing tobacco, people who use tobacco-free pouches. Should those people also get scanned, or is this only primarily for people who have used combustible cigarettes?
That's a great question. Right now, the screening guidelines are only for people who have smoked in the past, smoked combustible cigarettes in the past. But a lot of people, as you said, who vape, for example, they previously did smoke, and so there are a lot of people who currently vape who would be eligible to get screened for lung cancer. And but something that our team is trying to work on, and others in the nation, we are trying to figure out ways to thoughtfully expand the criteria so that people who may otherwise still be at high risk for developing lung cancer can get life-saving lung cancer screening.
Excellent. Well, I appreciate so much, Dr. Yang, that you joined today. I'm sure you have a busy schedule and you need to get back to your work. But we really thank you for your time. Certainly, as well, the X community appreciates it, and I'm sure that they'll be referring more people to do these scans. People are already paying it forward and recommending that people do scans. And if you're watching this and you aren't eligible, you don't fit that criteria, but you have a family member, an aunt, uncle, a parent, a grandma and grandpa, whatever, please encourage them if you feel that they fit this criteria, if they have a past history of using combustible tobacco, that they seek out and refer them to BecomeAnEX. We will certainly be a resource, or you can refer them to American Lung Cancer Screening Initiative at the website you see there on the screen. Thank you so much. I really look forward to having a discussion again. I'm sure this will spark new conversations on our community. And thank you so much for your time.
Thank you. We really appreciate it.
Thank you so
Excellent.
much for having us.
You're very welcome. Thank you. Again, this has been a production of BecomeAnEX.org in the X community. Thank you so much for joining. We hope to see you again on a future live event.